Rachel Zimmerman. I am currently a charge nurse RN at the village at Morrison's Cove, and also am attending Mount Aloysius College for my bachelor's degree of nursing. Today I am going to do a poster presentation based on the research question, do genetics or environmental factors play a larger role in the development of cleft lip and palate? I became interested in this topic when a child from my church was born with bilateral cleft lip and complete cleft palate. I wanted to know what was the cause of this. I will put close-up pictures of the poster on at the end of the presentation video, where you can also see the references used. First, we will look at some background information on cleft lip and palate, which can be found over here on the poster. Cleft lip involves disruption of tissue planes above the lip, which is considered incomplete, and can extend into the nares, which is considered complete. Cleft lip occurs when the two plates of the skull that form the hard palate do not join together correctly. A complete cleft palate involves a soft and hard palate, and also includes a gap in the jaw. An incomplete involves a soft palate with a hole in the roof of the mouth which connects directly into the nasal cavity. Cleft lip and cleft palate can occur together or separately, and the defects arise early in the embryological development. Individuals with cleft disorders can experience problems with feeding, hearing, and ear disease, speaking, and social behavior. Non-syndromic CLP describes an individual with no other related health problems, whereas syndromic CLP composes a wide range of malformation syndromes or birth disorders. The concern in the nursing practice and healthcare in general is cleft lip and cleft palate are listed among the most common congenital malformations worldwide. These defects arise in about 1.7 per 1,000 live-born babies. Many research studies have been performed to identify whether genetics or environmental factors play a larger role. The causes and prevention of CLP is relevant to the nursing practice for the following reasons: teaching patients in preventive care settings during childbearing years and prenatal teaching regarding further or continued explanation of genetic and environmental factors, nursing research, and ultimately to decrease the incidence of cleft lip and palate in the future. Data collection can be found over here. No specific design was used in this research project. The theoretical framework was based off of data collection and analysis, and also data comparison. Data was collected from numerous previously performed research studies and organized into one informative article. Articles were found by using Mac Library and other search engines such as Google to find databases and articles. Research was conducted on the ProQuest Nursing and Allied Health Sources and the National Center for Biotechnology Information Databases from 2007 to 2012. The key words: environmental and genetic causes of cleft lip and palate, environmental causes of cleft lip and palate, genetic cleft lip and palate, and causes of cleft lip and palate were used, finding over 12 related articles. These articles were then reviewed and analyzed, and the most important information pertaining to our research was drawn out of 5 articles and used in the new research. Statistical data can be found in the middle here. The highest prevalence rate for cleft lip and palate are among Native Americans, Asians, and then followed by Caucasians. Latin Americans and Africans were the lowest rate. Both cleft lip and palate occur twice as often in males as it does females. However, cleft palate alone has a higher incidence among females. Higher maternal and paternal age have a positive association in infants with cleft palate and accompanying defect. Infants born with cleft palate and another anomaly were much more likely to be preterm infants. Environmental factors can be found over here. Maternal smoking and heavy alcohol consumption have significantly high association with clefting. Maternal diabetes type 1 have also shown a higher risk for CLP. Drugs such as anticonvulsants, valproate acid, thalidomide, retinoic acid derivatives, and dilantin have a teratogenic effect on facial developments of the fetus. Deficiencies in vitamins and folic acid and also intrauterine irritation have shown a connection with these anomalies. Physical, chemical, and biological factors during the first trimester of pregnancy greatly increases your risk for cleft lip and palate, cleft palate, and also cleft palate alone. Physical factors such as physical traumas, heavy physical labors, and mothers who have previously experienced medical abortions before this pregnancy increases the risk by 5.8%, 12.9%, and 45% respectively. Chemical factors such as toxicosis, hormone displace, and exposure to chemicals increases your risk by 6.7%, 5.2%, and 5.2% respectively. Biological factors such as common cold and gynecological disorders increase your risk by 9.8% and 4% respectively. Other environmental exposures have been assessed for possible role in clefting, such as hyperthermia, maternal obesity, stress, ionizing radiation, and infection. Genetic factors can be found over here. Because of advances in genomics, positive genetic mutation causing syndromic forms of CLP have been identified. However, non-syndromic CLP remains more challenging due to its genetic heterogeneity. There are approximately 10 syndromic forms of CLP that are known, and one gene mutation from the IRF6, otherwise known as interferon regulatory factor 6 gene, that is associated with syndromic and non-syndromic forms of CLP. The most common type of syndromic CLP is van der Waals syndrome, which can include cleft lip and palate or just isolated cleft palate only. Genetic analysis of non-syndromic forms of CLP is extremely complex. Specific variants among candidate genes that show strong associations with non-syndromic clefting are mutations in MSX1, TGFA, PTHFR, TGFB3, SATB2, ACOD4, FGFR1, and FGF8. Also, we have environmental and genetic factors combined. It is interesting to find that in 3 of the 5 research articles, that one of the candidate genes found in non-syndromic CLP includes transforming growth factor alpha, otherwise known as TGFA. A TGFA variant, TAQIC2 allele, and maternal smoking together increases the risk of CP by 6 to 8 times and cleft lip and palate by 2 times. It was also noted in these articles that if multivitamins are not consumed during the first trimester of pregnancy with the presence of TGFA variant, TAQIC2 allele, the risk of cleft lip with or without palate increases by 3 to 8 times. The conclusion can be found here. In conclusion, thousands of newborns each year are born with cleft lip, cleft palate, and cleft lip and palate. Studies have been performed to identify both environmental and genetic factors, the combination of the two, and the risk associated with each. Environmental and genetic factors combined, such as smoking or not taking a multivitamin during pregnancy, along with the TGFA, transforming growth factor alpha, mutation, have shown an increase in cleft lip and palate. There are many syndromic types of CLP, with the most common being van der Waals syndrome, involving mutations in the IRF6, interferon regulatory factor 6 gene. Genetic associations of non-syndromic CLP include many candidate genes. MSX1 accounts for 2% of all non-syndromic cleft lip and palates. Environmental risk factors include smoking, heavy alcohol, use, absence of prenatal multivitamin consumption, physical and psychological stress, steroids, and anticonvulsant usage. Other factors linked to the offspring with CLP with other anomalies include older maternal and paternal aged parents, and premature infants. The data analyzed in this study will be implemented by providing information to prospective parents in genetic counseling, teaching prevention about the use of alcohol, smoking, and multivitamin supplementation, physical and psychological stress, and also diet. Overall, the environmental factors causing cleft lip and palate have been identified and can be prevented with teaching. Genetic factors have been identified in syndromic CLP. However, more research needs to be performed to find a definite cause in non-syndromic CLP. I hope you all have enjoyed my presentation and have learned something from it.